Hello, everyone. My name is Minna El-Turki from the Global Health Advocacy Incubator, and I'd like to first thank the Triangle Global Health Consortium for giving us time to share our work. GHA has been working on road safety in India for the past 6 years, and one of the ongoing challenges is having road safety highlighted as a national issue. Following the outbreak of COVID-19, we decided that while road safety is still a critical issue, we would take a step back. In the early days of the pandemic, India initiated the world's largest lockdown. While this intended to curb the spread of COVID-19, there were some unintended consequences. With all transportation coming to a sudden halt, millions of migrant workers had no way to reach home. Eventually, the government issued an order allowing stranded people to travel through a government bus program, and road safety advocates took notice that with a surge of people returning to the roads, India was about to see a surge in road traffic injury and death. GHAI and the Road Safety Network, including Save Life Foundation, an organization dedicated to strengthening road safety in India, decided to take action. Karuna Raina and Pooja Bhatia from Save Life Foundation are here today to tell us what happened next.
I'm Pooja from Save Life, and I'm excited to talk to you about our work today. In India, road crashes kill around 150,000 people every year, and this year was no different. When the lockdown started in March, there was the general perception that road crash deaths would eventually lessen due to low traffic volume on Indian roads. As an evidence-based organization, we decided to gather our own data to verify these claims. As part of the Road Safety Network, we at Save Life set up a road crash tracker to document the numbers of road crash deaths during the lockdown. We combed through over 30 national and regional news media sources to track and record stories of road crash deaths and injuries during the 4 phases of the lockdown. That is, from 25th March to 31st May 2020. And we started posting these updates twice daily on Twitter to draw the media and government's attention towards these numbers. So what did our tracker show? Our tracker showed that 750 people had lost their lives in over 1,400 road crashes in India during the lockdown, breaking the myth that Indian roads were safer during the lockdown. Out of the 750 deaths, 200 were those of migrants alone, while 40 deaths were those of essential workers, the rest being general road user deaths. This exercise highlighted the high severity of crashes during the lockdown and helped document the link between poverty and vulnerable road users. Finally, as someone who frequently engages in data, it was still tough to work on this because at the end of the day, these were not mere numbers, but real human lives, real flesh and blood lives that we were losing every second. I will now hand over to my colleague, Karuna.
Hello everyone, my name is Karuna and I would like to share outcomes and actions we took based on the data generated by the tracker. The COVID road crash death tracker turned out to be an important tool to highlight the vulnerability of road users. Empirically, it helped us establish that the severity and burden on public health systems had not diminished since the ratio of road crashes to road crash deaths was similar to pre-COVID times. In terms of outcomes, the data from the tracker was released to the media nationally and was covered in over 200 news stories across print and digital publications and helped us create a debate at the national and state level about the need for road safety even during lockdown. On 14th May, almost 1.5 months into tracking, Road Safety Network also sent a letter to the Union Home Secretary with all the data from the tracker. In order to assist the Government of India to keep the road users, especially passengers using migrant bus services, safe, the Road Safety Network also shared 15 safety protocols specifically to mitigate 5 key risk factors which emerged from the tracker. We also received queries from many state governments on the data for their state so that they could ensure safety of people during interstate transit. The data from tracker helped them prioritize safety measures on certain types of roads and people commuting in commercial vehicles. With this, I would now like to hand it back to you, Mena, for final closing comments.
Thank you, Karuna, and thank you, Pooja. In summary, road safety advocates were able to help raise focus on safety and injury prevention of migrant workers during this large-scale movement, motivate communication between central government and the state government on safe mobility, increase road safety coverage in the national and regional media, and improve public discourse on road safety as a major public health issue. With COVID-19 still very much around, we cannot afford to burden the already overburdened healthcare systems with road crash trauma. And as a global network, we are committed to improving road safety and saving lives. Thank you.